I'm Rebecca. I'm going to be her nurse today. We're going to be checking eyes, ears, nose, and throat. We're going to start with the Snellen eye chart. Lee, I'm going to give you this card, and what I want you to do first is to hold it over your left eye. And I want you to, whichever row you can see the clearest, I want you to read first.
The first row, E.
The very top row?
Mm-hmm.
Okay. Switch sides. And now which row can you read the clearest with your left eye?
The first row, E.
Okay. Do you wear glasses?
No.
Okay. I would suggest that you probably need to go have a vision. I think have a vision test because that shows both eyes are 20/200, which is not a normal reading for your eyesight.
Wow.
So yes, you should be down further on the chart. Definitely, I would go get your vision checked.
Okay.
Next, we're going to do another test. I'm going to have you hold this over your right eye. I'm also going to hold one over this eye. I want you to tell me, just say now when you first see my finger.
Now.
Okay? Tell me again.
Now.
Okay? And one more time.
Now.
Okay, good. Okay, that looked very normal. We were testing your peripheral vision on that. That looked really good. Okay, another one. I'm going to shine this light. I'm going to shine it right between both of your eyes. I don't want you to stare at the light. I want you just to stare. I'm going to step to the side. I want you you can stare at that chart or the cabinet or however, but just don't stare at the light. I'm just going to be looking at your eyes, okay? I know it's a little bright. Okay. Checking your corneal reflexes, and that looks good there too. All right, one more time, I'm going to use my pen light, and I'm going to check your pupils. And again, I don't want you to look at the light.
Okay.
I want you just to look straight ahead. You're going to see me just shine it. I'm going to come over like this. And I'm just looking for your pupils to decrease in size. And they do. That looks normal. Okay. One last test here before I get out my equipment. I want you to focus. Actually, I'm going to turn this on. I want you to focus on that light. Just look at that light. I don't want you to turn your head when I do this test. I'm going to check the gaze as how your eyes actually move.
Okay.
And as I move this light, I want you just to use your eyes to follow that light.
Sounds
okay?
good.
And don't move your head. Okay, very good. Go on the other side. Very good. And that looks normal. Okay, and we're going to move over here to the table. I'm just going to look at your eyes. Your eyes are symmetrical to your face. I'm going to pull down and look. Color is good. It's white. Now if you just look down for me, it looks good as well. Eyelashes and eyebrows, everything there looks normal. Okay, I'm going to look at the internal structures of your eye now. Okay. Now this one, I want you to just look straight ahead, look at the wall behind me. Actually, let me turn off this light real quick. That's better. Okay. Now I'm going to come closer to you. And we're going to get almost to where I touch forehead with you, but just keep looking ahead.
It's okay.
Okay. I could see the optic nerve back there. I could see blood vessels. They look normal. Everything looks good on that eye. Let's try the same thing with this eye. Make your eye water a little bit.
A little bit.
I know. I'm sorry.
It's okay.
Okay, look straight ahead.
Okay.
You okay?
Mm-hmm.
Okay. Same thing. I'm try to do it as quick as I can.
Okay.
I know it can be irritating. Okay, now one looks good as well. I see all the structures in there, the optic nerve,
Okay.
all the blood vessels, everything looks good. Okay, you have any questions for me on your eyes?
No, that's good.
Okay, like I said, something good would be to go ahead and make an appointment for eye doctor.
Sounds good.
You should do that every year, at least once a year, get your eyes checked and be screened
It's been a
for, glaucoma as well.
Sounds good.
Okay, next we're gonna check your ears.
All right.
Okay, you brush your hair back behind your ears. I'm gonna look just in front of you.
Okay.
Ears are symmetrical. Okay, I'm gonna look at this side. I'm looking for any lesions, any open areas, any sores. Skin cancers are common. People don't realize they'll get them at the top of their ears.
Yeah.
But that looks normal. Do you ever notice any discharge, any pain?
Mm-mm.
Okay, I'm just gonna push here. This is your, the outside of your ear, this part right here. Sometimes if you have an ear infection, you'll notice it will hurt right there.
Mhm.
Any pain when I do that?
Mhm.
Any pain when I pull here? Okay,
Good.
we'll look on this side as well. Same thing, I don't see any sores, any open areas. I'm gonna push again. Any pain?
No, ma'am.
Any pain there?
No.
Let me get my stuff together and
Alright.
we'll go look and take a peek. Alright, on here. Alright, I'm gonna pull your ear back.
Okay.
Okay, ear canal. Now feel me pulling here a little bit. Ear
Okay.
canal looks good. A little bit of wax, but not bad. And your tympanic membrane, which is your eardrum, is flat, which it should be.
Okay.
And it's a nice pearly white color, which means it's healthy and no infection.
Good.
Okay. And this one as well. Pull back a little bit. This one also a little bit of wax, but not much. And same thing, eardrum, your tympanic membrane is flat, which is, which is good. And the eardrum is cool, pearly white color. One last thing for your ears, I'm gonna perform what we call as a whisper
Okay.
test. And what I'm gonna do is I'm gonna whisper in this side of your ear. I'm gonna say a couple words, and I'm gonna ask you to repeat them to me
Okay.
to make sure that your hearing is good.
Sounds good.
Okay, let's see.
Charger. Apple. October.
Okay, hearing seems like it's good on that side. Let me try this side.
Christmas. January. Assessment.
Very good. Hearing is great on that one. All right, last thing we're going to do is we are going to check your mouth.
Okay.
I'm going to look at your, check your sinuses.
Okay.
Your nose, all that good stuff. Okay. So I didn't need to take that off just yet. Do you have any frequent colds or allergies? I think we were talking about allergies a little bit ago.
I'm allergic to animals, so whenever I dog sit, which I do often, lots of times my eyes will swell up and then I'll start sneezing and a runny nose, but that's the only real time that I have any problems with allergies.
Okay.
And of course during when the weather changes.
And do you take anything for
No,
allergies?
not really. I should be taking something, but I haven't
Okay.
taken anything.
Okay. All right. First thing I'm going to do, I'm just going to look. Nose looks fine. Looks symmetrical.
Okay.
I'm going to have you just tilt your head up a little bit. My light. I'm just going to peek. Okay.
Okay.
Terminates look good. I don't see any lesions. I don't see any drainage, anything like that. That looks fine.
Okay.
Okay, I'm going to push right here.
Mhm.
I've got maxillary sinus. Do you have any pain when I push there?
Mhm.
And this frontal sinus, any pain when I push there?
No, ma'am.
Okay, sinuses are good. Okay, now I'm going to next, I'm going to look in your mouth.
Okay.
Open up real big for me. Oh, somebody turn the light on. Okay, you stick out your tongue for me. Say ah. Okay. Have any issues with your mouth? Any sores? Any problems with teeth or gums?
I do have an abscess that I've still got from a tooth that I have to have a root canal for, just so I have to get taken care of. But
Okay.
it goes down, it comes and goes. So.
Okay. Okay. One more time, I want to see in the back there. I want to look at your uvula that's hanging out. I'm not going to stick it way back in. I'm just going to say ah real big for me. Okay. The uvula's hanging down real good back there. Looks normal, and I don't see any problems, any sores or redness in the back of your throat
Okay.
at all. I would recommend definitely that you keep up with regular dental appointments, get the abscess taken care of, and check for oral cancer. You said you didn't have any lesions, and I don't notice any lumps or any open areas in your mouth. So.
Thank you.
All right. You have any questions for me?
I'm good. Thank you.
All right.
Did a
Thank you
great
very
job.
much.